Hello, folks. It's Marvin Music with MedicareSchool.com, and we want to welcome you to this live stream event. For those of you that are joining us for the first time, I try to do these every 2 weeks or so, schedule permitting. And normally we're in a different setting. We are in our studio in our home office in Overland Park, Kansas, where I do all my broadcasting from. And normally I am with my son, Josh, and he, though, is in a conference right now, somewhere around the country, some conference. And so I did not want to postpone this for a week. So I decided that I would attempt to tackle this alone. I am not very technical, so I am being joined in the studio today by a young lady whose name is Jenny, who has worked with me and for me for years. And she is really my right-hand person. I don't know how I'd make it without her. So Jenny Bird is with us today, and she's going to try to monitor the questions. I guess you'd call her the call screener or the question screener. We will try to get to as many questions as possible. We'll just stay on as long as I can. I have time for. So we're thankful that you are part of this. For those of you that are already subscribers to our YouTube channel, part of our Facebook group, we're grateful. And if you haven't joined those, please do. We will keep you up to date on all things Medicare, Social Security as well. And so it's our purpose to make sure that people that are going on Medicare, going on Social Security are educated before they make any decisions. Sometimes people are railroaded into decisions, pressured by agents, or just don't take the time to really do the necessary homework before they start making these decisions. And sometimes they make mistakes. Those mistakes come with penalties, problems, sometimes cannot be reversed. And so we're committed as a company to make sure that before any decision is made, you have the proper education. And so that's the purpose of our YouTube channel. If you have never been to our website, MedicareSchool.com, I have an essentials workshop on there, an hour version, a 20-minute version that I would encourage you to watch if you're now contemplating what you're going to do with Medicare. There's a lot of information there that can be very helpful. All right, so please, if you have a question, please start typing those in right now. I am going to cover really for just a few minutes the topic of unlocking 5 hidden Medicare benefits. And frankly, folks, there's really a lot more than 5, but I'm going to get to at least 5, maybe a couple more, just to make sure that people are aware of some things that are usually not talked about when it comes to Medicare coverage. And the first thing I'm going to talk about is really hospice care. Now, you may know that hospice care is covered under Part A of Medicare. That's the hospital inpatient side of Medicare. And hospice benefits are paid very well through Part A. Hospice means that someone's been diagnosed with a terminal illness. A doctor has said that life expectancy is 6 months or less, could be longer, but that's what the doc's opinion is. And that's how someone qualifies for hospice care. Hospice care is what's called palliative care. It's really not treatment and trying to cure. It's more about pain management. And so it's just a different type of care. And that's covered under Medicare Part A. But one thing that people don't often know is that it's also possible for someone that's receiving hospice care to be able to go into an inpatient setting for respite care. And that coverage is actually for 5 days of inpatient respite care to give your caregiver, which is normally a family member or a friend, just kind of a break in the schedule. It can be very taxing being a caregiver. So Medicare says they will pay for your inpatient respite care for 5 days. And the only out-of-pocket expense you have is actually 5% of the Medicare approved amount. So Part A pays 95% of those expenses. And a lot of people just don't take advantage of that. And it really is an opportunity to give a relief to a caregiver. So you may be on hospice or you may be a caregiver right now. Just know that Medicare Part A will pay for that. Again, a hidden benefit that a lot of folks are not aware of. I also want to talk about acupuncture. Now, let's group chiropractic coverage under Medicare and acupuncture together, because sometimes it could be the same provider. But first off, when it comes to acupuncture, Medicare does pay for some acupuncture. They do have some rules about this. It has to be for chronic low back pain. And really, that's the only type of health condition that they're going to cover, but they'll cover up to 12 acupuncture visits, including dry needling, during a 90-day period. Okay, now there's some stipulations, some criteria for acupuncture. Number one is the pain that you has to be documented that it's lasts for at least 12 weeks, which is 3 months. It cannot have an identifiable cause, meaning it can't be because of cancer or some kind of an accident or something else. It has to be specific or something they're not exactly sure of. And then it cannot be pain associated with any kind of a surgery. And then what Medicare does is they'll cover 12 acupuncture visits. And if you're improving, they actually will cover 8 more. And I'm mentioning this because my wife has been helped greatly by dry needling. And so just know that Medicare does have some coverage. Again, we have some rules, but it's something that you may want to talk to your chiropractor about, or someone that's actually qualified to do acupuncture in the Medicare system. All right. And then another thing is very interesting as well that people don't use, and that is called advanced care planning. Now, many of you would be aware of what that is. It just means that you've come to a place where you are going to need some help making decisions. And sometimes people have not done any advanced care planning and they don't have that advanced directive. And so what happens is during your wellness visit, which is an annual visit, you actually can talk to your provider about advanced care planning, and they can facilitate that for you. And Medicare will actually pay for some, if not all, the cost of that. And again, a hidden benefit folks are not aware of. Also, I want to talk about this. This is really critical. I think most of you know that one of the leading causes of death among seniors is cardiovascular disease. And so Medicare is really quite proactive in helping people to diagnose their cardiovascular issues early. And so I would encourage you to take advantage of some of the screenings and different opportunities for you to see if there is some cardiovascular issues going on. Why? Because they want to detect these things early. It extends life and also saves them a tremendous amount of money. So let me just mention a couple of these important cardiovascular issues. Number one, they will cover, Medicare will cover a cardiovascular therapy visit once a year from your primary care doctor to begin discussing issues about cardiovascular disease. And there's no additional cost if you have that visit with your primary care physician. They also cover cardiovascular screenings, and these are blood tests to check cholesterol and lipids and triglycerides and all these different levels that may indicate whether you are at risk for a heart attack or a stroke. And these blood screening tests are actually covered by Medicare, which is normal risk of these every 5 years. And again, you pay nothing for that. So again, because it's such a big issue, I would make sure that you avail yourself of that. Now, this next one is really not a hidden benefit, but I want to remind people, especially you ladies, as you're on Medicare, that Medicare will cover Pap test and those kinds of exams for cervical and vaginal cancer. And they cover these once every 24 months. So you need to have that. And then also, if you're at high risk, they will cover that test every 12 months. All right, so be sure to take care of that. Now, one thing is very interesting. Medicare has several new items that they're covering this year. And I thought one of the one of the things I was surprised by what they're doing now is they're being proactive in helping you get some pain management and certain services whenever there's a couple of different chronic diseases that you may be dealing with, meaning you may be a diabetic, you may have some other ongoing kind of a health issue that's chronic. And so what they'll do, if you have these chronic conditions that persist for more than 3 months, they will get involved in the management and the treatment of those chronic conditions. Again, a brand new service. And so doctors actually now can get paid as they will put together a coordinated care plan for you to take advantage of that. And so hopefully if that's your condition, you will do so. Also, the last one I want to mention, we all know that dementia and Alzheimer, a big issue right now among the senior population. And so it's wise to start doing some assessments about that. And Medicare will cover some of those costs of that. And so again, during your annual wellness visit, your doctor can begin the conversation about cognitive disorders and start talking about detecting of dementia, Alzheimer's, those kinds of diseases. And you can actually do even a separate visit that Medicare will cover to get into the details and do a full review of any kind of possible cognitive disorder that you may have, or you may have, your spouse may have. I just had a client who's was doing great, and his wife called me and said his wife is really struggling with cognitive issues. And so the point is Medicare is going to participate in helping with the diagnosis and treatment of those kinds of things. Okay, so I could really go on and on, but I just want to make sure that you avail yourself of some of these things. Most of you already know that this year there was a change in the shingles vaccination. Prior to 2024, if you want a shingles vaccination, you usually had a deductible copayment on that. Today, that's covered by a preventive of Medicare at no cost to you at all. And so if you've not availed yourself of that shingles shot, it's 2 doses of that. Medicare will cover that through your Part D plan at no cost to you whatsoever. Okay, so if you have any other questions about other things, you can begin to ask those. And so, like I said, we're going to spend a lot of time now talking about different issues that are on your heart and mind. And let's get to those. Okay, Jenny, what's going to be our first question? All righty. Here we have Janice is writing, says, I've been on straight Medicare for over a year in December. Can I get a supplemental plan now or am I too late? And Janice, here's the way it works. When we first go on Medicare, and I know you're over that period of time, but I want to educate everyone. When we first go on Medicare, specifically Medicare Part B. Now, some people have their Medicare B the same time they have A if they start Medicare at 65. Other people have their B at a later date because they may have enrolled into A only and kept working, and then they pick up their B date. Here's my point. Once we have our Medicare B date, we're entering into a period of time that is called the Medigap open enrollment period. And this period is a 6-month window of your B date, folks. The B date's the key date here. So of the 6 months of the B date, 6 months prior to starting your B, you can apply for a Medicare supplemental plan with no underwriting required. And then 6 months after the B date, you can still apply for a Medicare supplemental plan, no underwriting required whatsoever. So that means in every state in the country, you have this window, 6 months before B, 6 months after, where you can get a supplemental plan, and the insurance company can ask you no health questions. They have to cover all your pre-existing conditions. They cannot charge any additional rate. So you are guaranteed acceptance into that supplemental plan of your choice. And that's called the Medigap open enrollment period. Now, obviously, Janice, you're over that period. So it doesn't mean you can't get a supplemental plan in Texas, but now, because the 6 months of the B date were beyond that, now you're going to have to medically qualify to do that. Now, that doesn't mean you have to be ready to run a marathon, Janice. It just simply means that we are going to have to ask you 30 health questions. We're going to have to check your medications that you're taking right now and have for the last 24 months. And that information is given to the insurance company, and you're going to go through underwriting. That means the underwriter is going to look over the medical questions, the prescriptions, and then make a decision whether they're going to approve your policy or not. Now, during that initial 6 months, they have to approve you. But after that, they do not have to approve you. They can deny you. And if your health is such where you cannot get one of those, I would suggest, Janice, the second best option then would be to get a Medicare Advantage plan. Now, you can't do that right now, but you can do that later this year. There are people that are switching Advantage plans, but you can't do that because you're not on one. And so what you can do later this year, October 15th to December 7th, you can enroll into an Advantage plan, and that plan will start January 1 of 2025. And I believe that that's a better option than A and B only. Now, I prefer supplemental plans, and for a lot of reasons, we'll probably get into that tonight. But I think having an Advantage plan is far better than having A and B only like you have right now. So can you get a supplemental plan? Yes, but you're going to have to go through underwriting to see if we can get you approved for that. And by the way, we'd be delighted to help you do that. I think Texas is our second or third largest state that we write in the country. We are a nationwide broker. And Janice, if you want to call our 800 number, it's 800-864-8890. 800-864-8890. And one of our agents can walk you through the application process. And frankly, there are some companies that are more picky than others. And so we're very aware of the underwriting guidelines and standards, and we'll do everything we can to get you a supplemental plan if that's possible. Okay, Jenny, what's the next question? All right, this comes, okay, it says here, do you cover supplemental plans in Massachusetts? We're different from the rest of the country with only 2 or 3 options. And yes, we do, most certainly. Now, what this person is saying, Massachusetts does this, Wisconsin does this as well, and they have, in Minnesota, they have plans of their own. Now, I will tell you, even though you don't have like the F, the G, the N plans, you do have plans that are equivalent to those. They just call them something differently. And so, yes, we write in Massachusetts. Again, if you want to call in 800-864-8890, we'd be happy to find that plan that would best suit your needs. Okay, we do right there for sure. So let us know if we can be of help. All right, next, this gentleman writes, my wife and I are getting divorced. We're both over 65. My wife will be entitled to half of my Social Security. Do I have to be drawing Social Security before she can start withdrawing it? Okay, here's the way it works. She is eligible for your Social Security benefits if you're taking them now. And so if you want to make sure that she's going to be eligible for those benefits, you may want to start taking your Social Security benefits before the divorce, because once you divorced, if you are not taking Social Security and you decide to put it off for a while, you have to actually be divorced for 2 years. Social Security calls that being an independent spouse. So if you're already taking Social Security, she can get it. But if you're not and you divorce, if you don't take, then she is going to have to wait till you start taking or wait 2 years. So let's say you put it off for 5 years. She doesn't have to wait 5 years, but she will have to wait 2 years until she's classified as an independent spouse. That's the way it works. Okay. Okay, I'm currently taking veterans medical benefits. It's beneficial to take Part D. And the person said, William says something else. I take something. Okay, we can't say it. William, let me answer your question just about the first one anyways. If you have your meds getting through VA, you do not have to have a Part D plan. The VA is considered credible coverage. TriCare will be credible coverage. Retired military, FEHB, retired civil service, credible coverage. So anyone on those types of plans, you do not have to have a Part D plan at all. Now, what I'd recommend, William, if you're Medicare eligible, well, we have a lot of veterans that really like the VA system. They will do what is called a Medicare Advantage only plan, MA only, which means there's no drug component built within that Medicare Advantage plan. And the reason that those are attractive is because if you like VA, you're probably going to primarily use VA. However, sometimes people like to have a civilian option. They like to go outside the VA. And the way to do that then is enroll in a Medicare Advantage plan only, meaning no drug component, but you still can see a specialist or a doctor or go to the hospital outside the VA system. And most of those premiums on those MA only plans are zero. In addition to that, you'll probably get some kind of reduction in your Part B. A lot of those plans right now are paying about $100 reduction in Part B for MA only plans. So that's very, very attractive to bring that Part B cost down. Now, if you're a veteran and you said, I don't like the VA system, then I would give you totally different advice. But if you like VA, I like that MA only plan. We write them all the time. Again, call our 800 number, 800-864-8890. And one of our agents would be happy to walk you through that process, William. Okay. If MC covers acupuncture, what about chiropractors? Okay, here's the way it works. Medicare does cover chiropractic care. Number one, the chiropractor has to, be in the Medicare system, which means they have to take Medicare. And then what's covered at that visit is they call it the subluxation of the spine, which is basically the adjustment of the spine only. Okay, that's all Medicare says is medically necessary for chiropractic care, adjustments of the spine. And so you can go there as long as the doctor takes Medicare, which means this: if the doc does any kind of, heat therapy or traction therapy or x-rays, none of that is going to be covered by Medicare, with the exception, as I talked about, acupuncture. You may be able to get coverage by a chiropractor for that. All right. Next, I have Grace. She says, I'm 65. Do I have to file for Medicare? I have insurance with my job. Do I file Part A? Okay, so here's the way that works, Grace. Do you have to file for Medicare? It just depends on how many employees are with your company. If you have 19 employees on the payroll, small group is what Medicare calls that, small group plan, 19 or fewer employees, you have to enroll in Medicare A and B, because Medicare in that situation is the first payer. And your group plan only has to pay second. And that just simply means that when someone is in a small group, and if they don't enroll in Medicare, they have some kind of a large claim, their group plan is still only going to pay second. And because they didn't enroll in Medicare, they become the first payer. So yes, if it's 19 or less, you have to enroll in Medicare. If it's 20 or more, you don't have to. You don't have to at all. In fact, you don't have to take A or you don't have to take B. Now, the reason it's fine to take Medicare A is as long as you don't have an HSA. That's called a health savings account. So those of you that are still working and you're covered by yours or your spouse's employer provided plan that has 20 or more employees on the payroll. It's not about the size of the group, it's the size of the payroll. And so we have 20 or more, you don't have to do anything with Medicare. And it's fine to do A only as long as you don't have an HSA, because if you have a health savings account, you can put no new money into that HSA once you have any part of Medicare, A only or A or B. No new money goes into the HSA. So those of you that have HSAs, I would not enroll into Medicare A. Medicare A is going to go in the second payer position anyways, probably not going to pay anything. It may, but it's better to have an HSA. Keep contributing to that HSA. Now, that doesn't apply to flexible spending accounts. It doesn't apply to what's called HRAs, health reimbursement arrangements, only HSAs. I think having the HSA, especially if you're maxing that out. And folks, if you have an HSA eligibility, you can put this year $4,150 into the HSA account, and you can put $1,000 extra as long as you're over 55. And so you can put in $5,150 pre-tax money that grows tax deferred and is tax exempt if you use it for medical expenses. So HSAs are wonderful. So I wouldn't take Medicare A if I had an HSA. Now, having said that, I know what most of you are hearing in the public. You're hearing, even if you keep working, you have to take Medicare A only, and if you don't, you'll be penalized. And that's absolutely not true. And the reason it's not true is because the only people that have to pay a penalty on Medicare A are those that have to buy it. Okay, who has to buy it? Anyone that doesn't have 40 quarters, 10 years worth of work paid into the Medicare tax system has to buy A. But if you have 40 quarters or more, or your spouse does, and you don't have to pay for A, there's never a penalty because the A penalties are a percentage. And so if A is premium free zero, what's 1,000% of zero? Zero. Okay, so the only people that pay penalties are those who have to buy A, and they have less than 40 quarters. They have to buy it. They better start it at 65 or they're going to be penalized. Okay, Larry, can a prescription drug company stop covering a drug in the middle of the year a person is signed up for their coverage? Well, I say this to you, Larry, that does not happen often. I will tell you this, that if the FDA pulls that medication during the year, then that could happen. I also think it could be possible for that to happen if a generic equivalent or a generic alternative came available. Then you may have to try that lower cost medication to get that brand name medication filled. But as a general rule, we just don't see that often. But I'm not saying it never could happen, but it's not just because they don't want to cover it anymore. If it was in the formulary going into 2024, they're going to cover that medication, again, unless FDA dropped it or there became a cheaper alternative or equivalent medication. All right, Roy, what if a person needs to take meds to manage cancer? Okay, well, if it's oral cancer meds, those are normally covered, Roy, by Medicare Part B. Now, I said usually, not always, but usually covered by Medicare Part B. And your cancer doc, I'm blanking on what in the world they call the cancer doc. I'm blanking. That's terrible. Anyways, whatever. But your doctor is going to know which meds are going to be covered by Medicare Part B or Part D plans. Now, let me explain this. Even if, and I'm not trying to minimize the pain, okay, of cost, but even if you had to take a cancer medication, oral medication, self-administered, that's not covered by B, but rather by Part D plans. Here's the good news. This year, in 2024, oncologists, by the way, that's what they're called. I'm 63. I show my age all too often. But if you're on a Part D plan and it's covering the oral medication, the maximum this year that you would spend is going to be somewhere between about $3,300 to $3,700, depending upon if you have a deductible or not. That's the max. That's the cap that we'll spend this year because this year Medicare took the catastrophic phase to zero copay. Used to be 5%, so it could be a lot more. But this year, the most you'll spend, folks, in all your meds, anywhere from in that $3,300 to $3,700 range. I don't care if your meds are $20,000 a month; it makes no difference. You'll cap out in that range, $3,300 to $3,700. Next year, it's going to be better. It goes capped out at $2,000. All right. So again, usually covered by B. If not, it's covered by D, but there is a cap on that. Okay, let's keep going. Jeff, I'm turning 65 in July. I have Medicaid now. How long will Medicare work Okay, when I am on Medicaid. So here's the way it works, Jeff. Once you turn 65, Medicaid is going to go into the second position. Medicare has to pay first, Medicaid would pay second. Now, what you have to be careful of, Jeff, is sometimes people actually will lose their Medicaid eligibility once they're eligible for Medicare. So you need to be proactive and find out if that Medicaid eligibility is going to continue on. And if it's going to continue on, what's going to happen is probably your state Medicaid is going to pay for your Part B premium, which is a huge blessing to you. And then what most people do that are on Medicaid is then they will get what's called a dual special needs plan. We use the acronym DSNP. And by the way, Jeff, we're happy to help you that we write those plans all the time. But this is a Medicare Advantage plan designed specially for those that are dual eligible for Medicare and Medicaid. And those programs are very, very nice. You'll see you'll have either zero or very low out of pocket on your meds, zero or low out of pocket on all your medical expenses as well, called the dual special needs plans for Medicare, Medicaid eligibility. But again, check to make sure you're going to maintain that Medicaid eligibility once you're 65. Okay, Karen, I have a plan in with one company. Can I just keep the same plan but change companies? Well, Karen, just depends on where you live. All right, so let me explain. There are about 15 states in the country that have rules beyond the federal guidelines. Okay, beyond federal guidelines. Because the federal guidelines say that once you have exercised that right that I taught about earlier, remember that 6 months of that B date, remember we can apply before and we can apply 6 months after our B date. And if that 6-month window is over now, most states say that if you want to get a different supplemental plan, different letter, different company, now you have to go through medical underwriting. Okay, that's the normal rule. However, states are given the right, if they want, to add some additional benefits, which are consumer friendly, to those federal rules. So, Karen, I don't know where you are on the questions here, but if I knew where you're from, I could tell you how exactly that works. Now, let me clarify something because this may come up with some of the others of you about this. When I say there's rules beyond the federal guidelines, what I'm saying is that some states have a way for people that are on an existing Medicare supplemental plan to change that plan and move to a different company and a different, a like-to-like switch. So let's make it simple. You're on an N. So a like-to-like switch means that you can move in some states from an N to N without medical qualifying, okay? And that period of time is normally called a birthday rule. It's a state that says around your birthday, you can switch like to like. For you, Karen, N to N, no medical underwriting. I'll tell you who those states are in a second. Now, some of you that are on G plans, you can move a G to G. Now, most states say you can move like to like or like to lesser. So, Karen, if you're on a G plan, you could move to another G or a G down to an N. So, like to like or like to lesser. No underwriting. Okay, now those birthday rule states would be these: California, Oregon, Idaho, Nevada, Oklahoma, Louisiana, Maryland. That's it. Pretty sure those are the ones. And those states have a birthday rule. And what that means is, and I'm not going to tell you all the states' rules other than to say this. Some states, that birthday rule starts on your birthday, goes for the next 30 days, some the next 60 days. California is 90 days, 30 days before your birthday, 60 days after. So again, you got to find out what state you're in. And by the way, you call in, we can work you through that. But the point is, if you have a birthday rule state, again, we can move like to less, no underwriting required. Now, listen to this. The state of Louisiana says you can do that, but you have to stay with the same carrier. So we can move like to less, but if you're with, let's say, United Healthcare, you got to stay with them. The state of Illinois has the same criteria. You can't change carriers, and you can only do that between the ages of 65 and 75. All right. And so that's the way it works. Missouri has an anniversary rule. Works just like the birthday, but it's tied to the anniversary of the policy. 30 days before, 30 days after. Now, the state of Washington, it's 12 months. You can move like to less in the state of Washington any month of the year, all 12 months. Now, folks, when I talk about this is people that already have a supplemental plan and want to switch with no underwriting. Now, those of you that don't live in those states, you can still move and switch your supplemental plans, but now we have to go through medical underwriting. And again, that's a process involved, but again, many, many people can do that. Now, I want to clarify one more thing. Those of you that are in New York, you have open enrollment all year long. Those of you that are in, I think it's Connecticut, again, open enrollment all year long. Vermont, I think it's the month of February and March. Maine is, I think it's the month of February, it's just 1 month. So we have those 4 states, New York, Connecticut, Maine, Massachusetts, where they have either open enrollment year round or certain periods of time. So you don't have to worry about underwriting at all if you make those moves during those particular periods of time in those states. All right, let's keep going. Donna, I might have missed this, but does Medicare cover blood work each year at your annual checkup? No, not as a general rule. Okay, let me back up and say this. When you are on Medicare, your first year, you qualify for what's called a welcome to Medicare kind of a visit. After that, they're wellness exams. And so that's not necessarily going to include blood work unless the doctor finds something during that visit where that doc wants to order some blood work. Then that would be coded differently. But as a general rule, that's not going to be covered under preventive. We did talk about one screening. I can't remember what screening it was. I think it came up every 5 years. So, but the point is, talk to your provider and they'll know what's covered by Medicare or not. And the key to this, and I tell our clients this all the time, when you get off of a group plan, most of those group plans had very nice wellness packages that included very detailed blood work and all those kind of things, because those group plans try to beef that up so that someone that's 30 at least gets something out of the plan. Well, when you're on Medicare, it doesn't work that way. They have different criteria. And so they will cover certain blood work, but it can't be under the preventive code. It has to be under diagnostic, and your doctor, of course, would know that. So if you're just curious about something, not going to be covered by preventive. All right. Once I sign up for Medicare, supplemental, and dental plans, will these plans automatically renew every year, or am I required to reapply to keep the same plan? Okay. The only plans are that require you to review them and possibly switch them are only 2: Medicare Advantage plans and prescription drug plans. Those are only written for 1 calendar year at a time. Medicare A and B is lifetime. Supplemental plans are lifetime as long as you pay the premium, and dental plans the same way. So you pay those premiums on those 3 things you ask about, you will keep those for life. Only drug plans and advantage plans are annual plans. All right, Robert, my wife and I are on Supplemental G, but it has no dental and vision. Can you group help find affordable dental and vision plans? Yes, we can. Okay, for sure. You can call in and happy to help you do that. Now, listen, I want you to know something, Robert. You do have wonderful, wonderful vision benefits on your A and B and your supplemental plan. Okay, the only thing that A and B in your supplemental plan is not going to cover is going to be eye exams for eyewear and eyewear itself, unless it's after cataract surgery. Got it? So Medicare covers glaucoma, covers cataract surgery. It'll cover your wet macular degeneration, dry macular, all those kinds of things, including injections in the eye when those are necessary with wet macular. And so the point is, you have great coverage with vision. Only thing they don't cover, eye exams for eyewear and eyewear itself, unless after cataract surgery. Okay, now when it comes to dental, Medicare, nothing hardly for dental other than, after jaw cancer or, before some kind of heart valve replacement. So in dental, you're going to have to get your own type of plan, and there's a variety of them. I'm on one, and happy to assist in that if you give us a call. Okay, let's keep going. All right, Jeff, question. Can you talk about the cost of prescription plans? I sure can. So we're talking about what we call standalone drug plans, Part D plans. And so right now there are some plans that are as low as 0 premium, very low, maybe 50 cents, $1, whatever. And there's some plans that would be as high as $100. And so the majority of people today are not going to have to be on a $100 a month drug plan. So the cost of them are going to vary. In some zip codes, we're going to be able to have anywhere from 15 to maybe 20, 25 different drug plans available. So what you do is this: because drug plans are only written for 1 year at a time, you find a drug plan that's good for you for this year, which means what meds are you taking now, what pharmacy do you want to go to? And we put that information into a system. There's plenty of those available. And it looks at all the drug plans in your zip code, and it takes those plans and it rates them in order of annual cost and coverage, because frankly, the premium is not the biggest deal. The biggest deal is that you get your medications covered. And so, yeah, we let the software do the work, and it takes these plans and looks at all of them. And we pick the plan based upon your current meds, which means that if your meds were to change throughout the year, you can change your drug plan every year. You update your meds, dosage frequency, it reshops them, and it'll tell you exactly what plan is best for you for 2025. And so the point is there is a cost, again, low to high, and the difference is really just the formulary. If someone takes a couple generics, you can get by with a very low cost plan. I mean, probably definitely less than $20, probably less than $5. And it'll be a good plan, probably 2,500 meds in the formulary. If someone is taking, let's say, 3 or 4 brand names, maybe a couple generics, probably not going to get by with a low cost plan. Probably going to be a mid-range plan, somewhere between $25 to maybe $50 a month. But that's all right. Why? Because you're going to get more medications covered. That plan is going to have probably 3,500 meds in the formulary. And if you see plans that are $75 up, those are people need those that are taking 15, 20 prescriptions a day. Okay, not pills, but prescriptions a day. To get all those covered, we're probably going to have to be in a larger formulary plan. Those plans are going to cover about 4,500 medications, almost everything that's available. Now, listen, there is no plan that covers all meds. That's not going to happen. But usually we can find a plan that's going to cover your meds depending on how many you're going to take. And so it's the size of the formulary that will determine the cost of that plan. But the good news is, again, you can change them every year, October 15th to December 7th for a January 1 effective date. All right, who's next? Tammy, if I retire this year and have to sign up for Medicare in June, how do I avoid paying the Erma $450 and have them look at this year instead of 22 and 2023? Okay, it's real easy to do that. So if we're going to start Medicare this year, let's say June, they are going to automatically, Tam, look back at 2022. Automatically going to do that because that's just the rules. And by the way, those of you that aren't familiar with this acronym she has here, it's called an Erma, and it stands for Income-Related Monthly Adjustment Amounts. And what that means is that a single filer that makes above $103,000 a year, a married couple that files a joint return makes above $206,000 a year. So those are the income thresholds. So again, single above 103, married above 206. If we're above those thresholds, now we have additional surcharges for Medicare Part B as well as for our drug plans. So that's what she's referring to as an Erma, income-related monthly adjustment amount. And so when we're on Medicare, Medicare always looks back 2 years to determine what our modified adjusted gross income is. Modified adjusted gross income is line 11 on your tax return plus line 2A. So if you want to know what it is, look at line 11, look at line 2A. You put those two numbers together, and that gives us a number that Medicare uses to establish our Part B premium. And again, if we're above 103 or 206 as a couple, you're going to pay those Ermas. So they naturally look back 2 years. But if we have a qualifying life-changing event, there's 8 possible life-changing events, okay? 8, and only 8, okay? And that would be you've had a death in the family, there's been a divorce, there's been a marriage, work stoppage, work reduction, loss of income producing property, which means you had an apartment complex or something and it burned up, or it went down a mudslide or something, it's gone. Or you have an employment settlement agreement that went bankrupt, or a pension type of income that it went bankrupt as well. 8 life-changing events. Most people use work stoppage or work reduction. So here's what happens, Tam. And when you retire in June, again, they're going to look back at 2022, and then you're going to get a letter. You cannot do this until the letter comes. You apply for your Medicare A and B, and they're going to send you a letter within 2 weeks, 3 weeks. And it's going to say, hey, by the way, Tam, we looked at your IRS records, and you made X amount of money, and I can see with an Erma 450, 420, your high income for sure. That's about the highest level that they have. And you'll get the letter, and they'll say, here's what we're going to charge you for your Part B. However, if you had a life-changing event, again, one of those 8 that I talked about, then you can appeal the Erma. You can appeal it. And so the way you appeal it, again, letter has to come, and you fill out a form called an SS-44. Now, Tam, if you use our company and we become your broker, no cost to you at all, we will help you and do all that with you and for you. We do those all the time. It's called an Erma appeal. It's an 8-page document. You only have to submit 3 pages, and we're happy to assist in that process. So what you do in the appeal is you're saying this: stop looking at 2022. I had a life-changing event in 23 or 24. You put down the date of that life-changing event. For you, it'd be June of 2024, and they will not look back, and you can give them new financial numbers for 2024. And so what happens when you appeal to Erma then they will drop off the Erma or reduce the Erma. We tell people, even if you go down 1 level or 2 levels, it's worth your time to appeal the Ermas. Again, that's the SSA-44 form, appealing Ermas. All right, that's the process. Keep going. All right, here we are. We have been together for many years, but not married. I'm currently retired and receiving Social Security. If we get married, will she be able to get spousal benefits when she turns 62? Okay, and you're taking, and yes, she will. However, 1 year later, it won't be automatic. The rules are, if you're going to take spousal benefits, you have to be married a year. Got to prove that with a marriage license. Now, keep this in mind. She will get about 30%. Again, I'm just giving you kind of a ballpark. She's going to get about 30%, maybe a little bit less, because of the penalty. Anytime we take Social Security early, whether that's spousal, survivor benefits, our own retirement benefits, we take it early. We always take less. There's a penalty. It's usually about 6% a year on our own account, and it's not quite about 7% when we take spousal. So if she's going to take at 62, she's going to lose that 30, maybe 35% of what you were eligible for at your full retirement age. Again, but you have the checks longer longer period of time, so it may be fine to do that. But you got to be married a year and has to be proven with a marriage license. All right. Do I have to keep Part D if I have Part C? Okay, here's the way that works. Rudy, yes, you should, unless you can get your prescriptions to the VA, TriCare, retired military, or FEHB. You want to keep the C plan. Now, your D plan. The majority of Advantage plans, C plans, have embedded a Part D plan. And so, yes, you have to, unless you have other credible coverage. Okay, keep going. All right, Andy. Hello, I'm 64, retiring later this year, taking COBRA until I turn 65. My wife is retired on my company benefits plan and on Medicare A. Can I pay into HSA even though my wife is on A? Okay, you got a couple things going on here. First, Andy, I'm going to give you a word of advice. And maybe you know this, but I've seen people mess this up. When you retire and you're on COBRA, you have to put your wife on A and B the month you're retired. Okay, you have to, because what happens is that COBRA plan is going to pay first for you until you hit 65. But because she's already Medicare eligible, COBRA goes into the second payer position. So it's the first payer for you, but it's only the second payer for her. So let's say let's say your month you retire is November. You want to be sure that when that active employment ends, the very next month, you want your wife's Medicare B to start. So if you keep the COBRA, that's fine. But listen, don't keep the COBRA for her any longer than 6 months, because if she stays on COBRA longer than 6 months, drops a COBRA and now she's going to have to get a supplemental plan. Unless you live in New York or Connecticut, Maine, or Massachusetts, she's going to have to medically qualify to get a supplemental plan. So don't use that COBRA too long. And I know the temptation is use it because a lot of times it's very low cost. Companies pay for that sometimes. All right. Now the other question. Oh, wait, that's right. Let's go back just for a second. And then he was asking, can I pay into an HSA even though my wife is on A? Okay, yes, you can continue to contribute to your individual plan, but not the family plan. Right now, you can contribute $4,150 a year, $1,000 catch up, and nothing for her because she has Medicare A. So just as long as you're not overfunding your account. And then if you start Medicare, of course, I know this is going to happen. You're going to start Medicare right when you turn 65. So the month before you turn 65 and start your Medicare A and B, that month should be the last time you contribute to your HSA. So no new contributions, because once we have A or B or both, no new money can go into the HSA. Otherwise, we've overfunded it, and we have to pay taxes on the money we put in and a 6% penalty until we draw that out. Okay, let's keep going. All right, Dina, May 1st, we're scheduled to go on Medicare. My husband, COBRA is better than Medicare as I have cancer and my meds are over $21,000 a month. Can I go on COBRA instead of Medicare and not get a penalty? Okay, let me go back. So schedule to go on Medicare. Husband, COBRA is better than Medicare as I have cancer, my meds. Okay. All right. Well, first off, can I go on COBRA instead of Medicare and not get a penalty? Okay, here's what happens. You can keep your COBRA, Dina, but you have to go on Medicare at 65 or when you lose a group plan, because COBRA, again, as I've said earlier, goes into the second payer position. So you've got to go on Medicare. But your COBRA, I think it is fine to use your COBRA, no problem. It'll pay second. And I'm almost positive that that your COBRA insurance can be used for your medications. Okay. And by the way, if I'm wrong about that, keep this in mind, Dina. Once you're on a Medicare Part D plan, the most you're going to spend this year is what I said earlier is between about $3,300 to $3,700 total out of pocket. And if it's chemotherapy, Part B pays for it anyways. So it's only your self-administered meds that we would be concerned about. And they have a cap this year of, like I said, $3,300 to $3,700. So worst case scenario, that's all you're going to be out of pocket. All right. So I guess I've answered your question other than I don't know if I can say dogmatically that that your COBRA plan will still agree to pay for those medications. You've got to enroll in A and B. I know that. So you may want to call them and ask them if they will cover your meds. Yes, A and B is going into effect. So the question will be on the D plan. So if they say we're not covering them, then you know you're going to roll into a D plan. And we know we at least have some limits. Next year, it's even better, $2,000 on the cap. Okay, let's keep going. All right. If someone doesn't have 40 quarters, so do they have to buy both Medicare A and B? Okay, so everyone pays for B anyways. So let's talk about A. A, yes, if you don't have A, unless you qualify for Medicaid, state Medicaid oftentimes will pay for the Part A premium. And now the Part A premiums this year, if you have 0 to 29 quarters, Part A costs $505 a month. If you have 30 to 39 quarters, Part A costs $278 a month. And if you don't enroll when you're first eligible at 65, then you're going to be penalized down the road. So the question is, can you get those quarters from somebody else? If you're married, your spouse has to be at least 62, have their own 40 quarters. Been married for a year, you can draw those quarters. If you're not married, if you were married to someone that's at least 62, you're married to them 10 years and didn't remarry prior to the age of 60, you can draw those 40 quarters actually from an ex-spouse. So if that's off the table, then you're going to have to pay for A, or you'll pay a penalty. Or unless you're on Medicaid, they'll pay for it. Part B has a premium for all people. And if your income's below 103 as a single, 206 as a couple, you'll pay $174.70 a month. Now, if you're low income and you qualify for what's called Medicare Extra Help, then some of those savings plans with Medicare can also offset your expenses on Medicare Part B. But you're going to have to apply for those. And you can apply for those through state Medicaid, or you can apply through a Social Security office as well. All right, I'm turning 65 tomorrow, still working full time. What should I do? And call about this. Okay, Ebert, as long as your group plan or your spouse, I think you said you're still working. Okay, as long as there's 20 employees on the payroll at your company or more, you don't have to do anything with Medicare A or B. And as long as you've been working at least 10 years paying into Medicare taxes, you'll never be penalized on Medicare A. If you don't have an HSA, what I would do is I would go online, set up a myssa.gov account, and enroll in Medicare A only. Remember, only people that have an HSA, should not enroll into Medicare A. So if you don't have an HSA, enroll into A only. You get in the system, and then you can pick a B at a later date when you lose that group plan. Again, I'm assuming the group is 20 or more employees. All right. Hope that helped. Kina, question. Can a person work while receiving Social Security benefits? If I'm correct, I can make $20,300 per year above the Social Security benefit. Thank you for explaining. Okay. A person can. This is called the earnings test. The earnings test. And your number is not quite right. You're close. This year, the number is $22,320. I think that's right. $22,320. Anyway, but it's an earnings test. And so as long as your wages, and by the way, they only test wages. Earnings test has nothing to do with investment income, rental income, pensions, annuities. None of that is tested, just working wages. So as long as you stay below that limit, $22,320 right now, then you'll not be penalized. Now, here's where it gets a little tricky. The year you turn full retirement age, it's the year you turn, okay? You're not yet full retirement age. We're just turning that year. That number goes up. That number this year is $59,520. It goes up huge amount the year you turn. But once you have hit your full retirement age month and year, the earnings test goes away. So then we can work and make as much money as we want. There's no penalty, no withholding of Social Security checks. once we hit full retirement age. But prior to that, we have those two different numbers. When I teach it, I teach the low number and the high number. The low number is all the way up until December before we hit the year we turn full retirement age. The high number is January up until the month before we actually turn full retirement age. So again, 22,320 and 59,520. All right. Okay, so I retire at 66 and 10 months. When is the best time to file for Medicare? So I'm assuming you're born in 1959. And so what I would do, if I were you, is I would apply about 3 months in advance. Now, if you decide to take Social Security at the same time, you actually can apply 4 months in advance. Medicare self-enrollment is 3 months, Social Security 4 months. And by the way, Grace, if you want us to help you with that, we do it all the time. All of our agents are well-versed in Social Security. And a lot of times people want to do the two at the same time. And it's really good to do that. So about 3 to 4 months before you're 6610, then I would apply for Social Security. And if you're going to start Medicare, we can include that in the application as well. Okay, my birthday is September. I had TriCare Prime. Do you think TriCare, for life is enough to cover expenses? Let me say this. I think TriCare for life is very good insurance. And I'm glad as a military retiree you have that. And so if you decide to stay on the TriCare, which you're going to, of course, and no cost to you, then you have to enroll in Medicare A and B because TriCare will only pay second once you're Medicare eligible. So you would have A and B and you have TriCare. Now, what a lot of veterans are doing, I'm saying you have to do this, but it's certainly an option. What a lot of veterans are doing today is they are taking what is called an MA only plan, Medicare Advantage only. I love supplemental plans, but being on TriCare, you don't need one. But what you may want to take advantage of is a Medicare Advantage only plan. And what that means is because you're eligible for Medicare, TriCare will coordinate benefits either with A and B, or they'll coordinate benefits with your Medicare Advantage plan. Okay, so what's the benefit of that? Well, when you enroll in that MA only plan, many times they give you a reduction in your Part B. Again, sometimes $100 a month. So we take that $174.70, and then MA plan offsets that by about $100. And then you get some of the perks that are offered with Advantage plans. Now, listen, those of you who are hearing this, I would never enroll into an Advantage plan just because of the perks. I care about how the insurance is going to work. But in your situation, TriCare will coordinate with that Medicare Advantage only plan, and then you get to take advantage of the perks at no cost to you whatsoever. All right. Now, I would tell you this. We would do a PPO plan. We would want to make sure your doctors and hospitals are in the network and all those kind of issues. So a lot of veterans are doing that. It's called the MA only plan, and you get your medications through TriCare, and that is considered credible coverage. And that's a very nice package for many people that have TriCare. Okay. All right, I'm 68, working at a large company and participating in our health plan continuously. My wife turned 65 in August. Should we start Medicare together in August or wait and do so next January? Okay, well, again, Kirk, as long as the employer has 20, you said large, so that's good. We know we got that. So what I would do, Kirk, is if the plan is good, it's a good plan. You like the cost, you like the coverage. I would do nothing with her either. Just wait on that. Should we try or wait until next? Okay, August. Yeah. So you're fine to wait. I would wait. But one thing I would check, Kirk, is this. I've seen people before in a situation where you need to ask your employer, what does it cost you to cover your wife? Which means what is the employee-only premium and what is the employee plus spouse premium? Because sometimes I've seen employee-only premiums $100, add the spouse, it's $500. And so if you're paying a lot of money just to have her covered, then I would go ahead and you stay on the group plan if it's good and affordable and put her on Medicare. Now, if the price is cheap for both of you, then I would do nothing with Medicare A or B. Not a problem until you decide to retire in January. Now, here's the way that's going to work. You're going to come into Medicare, both of you now, because she will be over her initial enrollment period. For birthdays in August, that ends September, October, November. Yeah, so she'll come in using a special enrollment period. No big deal. It just means that we have to prove credible coverage through your group plan. Your HR department would fill out a form. You initiate the form. It's called an L564. And you work with us. We'll do all this with you and for you. But you have to submit the L564, one for you, one for her, to the HR department. They're going to verify credible coverage back to 65. And that allows you to come into Medicare with no penalties and no problem. That's called the special enrollment period. And we attach to that form one that goes to the Social Security office called the 40B. And that form lets them know when you want to start your Medicare. The 40B on your form sounds like you would just say, we want to start that in January, and you'll be fine to do it that way. So here's the point. If you've got good costs, good coverage, you like all that, do nothing until you're ready to retire. Then both of you come in using special enrollment period. All right. All right, Shane, when you sign up for a G plan, is the monthly cost and yearly percent increase the only thing that will be different between companies? Coverage will be the same between companies. And you're right, Shane. And that is called standardized plans by Medicare. So if you buy a G plan, remember what happens. That G plan covers everything but the Medicare B deductible. So as long as Medicare pays first, all the other gaps are covered by G except the B deductible. So that would be regardless of who you chose. ABC insurance company, XYZ insurance company, doesn't matter. The coverage is all the same. So the only difference is initial monthly premium and the stability of the rates. And so we take the time with our clients to be sure we look at stability. What are the carriers doing in your market? How much of a market share do they have? Because we're looking for large groups because that risk is spread out to more policyholders. So we take the time to investigate stability of rates in every single market before we write a plan. What about using programs like GoodRx along with a low cost? Great idea, Al. I like GoodRx. I like Kubin's group, Cost Plus Drug Company. Those are wonderful. Now, those are not Part D plans, of course, but they are ways to get reduced costs. So I think you're wise. Get a Part D plan. GoodRx is not considered credible. Kubin's group's not considered credible. So get a low-cost plan, shop the meds. Sometimes it's better to run it through the plan. Sometimes it's better just to use a GoodRx coupon to save money that way. I'm on Medicare Disability and I can retire. Will that hurt me as far as my? No. In fact, your Social Security disability payments you're getting monthly are basically the same amount that you would have received when you hit your full retirement age. So you're not going to see any change at all. You may see it go up because of a cost of living adjustment, but you're not going to see that reduced once you start taking once you retire. I've never seen that before. So you should be fine. I'm on Medicare Disability, and again, I can retire. Will that hurt me as far as? Is this another question or same one?
No, that's the same one. Sorry.
Okay. I'm sorry. Can you go back for just a second? Yes. I am so sorry. And if you can't find it, it's fine. I think I answered most questions. So if I'm on Medicare Disability and I can retire, will that hurt me as far as my? No. Now, one thing you need to keep in mind, Jim, if you started Medicare because of disability, meaning you started before 65, one key thing for you is that once you are hit 65, you're going to have a second eligibility to make Medicare decisions. So you may live in a state where you couldn't get a supplemental plan. If you did, you may live in a state that had a higher rate. So once you hit 65, they restart the clock for you as far as your Medicare goes. Take the time then to look at your supplemental plan options because you may see that premium come down because you're just coming in regularly at 65. We call this your IEP 2. It's your second opportunity to make Medicare decisions. Okay, that happens at 65. But Social Security will not be affected whatsoever that I'm aware of. Okay, good. Albert, I started working at 16. At 21, I did police for 25 years, got a pension starting. Will I get Social Security when I apply at 67? Well, it just depends, Albert. Were you paying into Social Security? Because some government jobs, you did not pay into Social Security. If you had your own police pension and they were not withholding for Social Security, then you're not going to be eligible for that. All right. So again, I don't know enough to tell you what to do in that regard. So what happens is if you paid into Social Security, then you could be eligible to receive both for sure. But if not, you're not going to be able to do that. Okay. Social Security Medicare automatically kick in, or do I have to enroll? No. What's going to happen, DL? Anyone that is receiving any form of Social Security benefits, retirement, spousal, or survivor, is automatically enrolled into Medicare A and B at 65. And the card, your Medicare card, is going to come to you in the mail. It arrives about 100 days prior to your birth month. 100 days prior to your birth month. Because remember, folks, we always start Medicare on our birth month unless we're born on the first day of the month. If your birthday is December 1, they move you to November. But if you're born December 2nd thereafter, you're going to start your Medicare in December on your 65th birth month. So the card always shows up about 3.5 months before your birth month. automatically enroll. Now, those of you that are not on Social Security, you have to self-enroll. And again, you start doing that as early as 3 months prior to your 65th birth month. All right, what's next? Okay, I'm a family practice doc. Good. Have a PT who's on disability due to her medical issues at age 63. She currently is on Advantage plan due to out-of-pocket max on Advantage. She's age 65. Can she then revert back to it? Yes, she can. Yes, she can. You're exactly right. And that's what I just talked about just a couple of questions ago. She qualifies for, David, what's called an IEP2. So she can reset the clock her 65th birth month. She actually has 6 months after that to do that, but I would be doing it in advance of that. But she can definitely reset the clock and get a supplemental plan, no underwriting whatsoever. That insurance company of choice or plan. Now, she is going to, well, it just depends. But she can get anything she wants. That's in your particular area. Any company, any plan. Okay, Janet. Be 65 in April. I'm on my husband's. Okay. Well, it just depends. If your husband is paying for the ex-husband paying for that plan, and he's going to continue to work, then here's what I need to find out something, Janet. I need to know. It sounds like his is active employment insurance. So what you need to be mindful of is if his group plan is 20 or more and you enroll in A and B, then A and B is going to pay second. His group plan is going to pay first if he keeps working. And so what you may want to consider, Janet, is if it's a good group plan, he's going to keep paying for it, all that works. What I would do is I would delay taking B. You're going to get your card, but you can send the card back in and enroll into A only. Because again, you're going to pay for that B premium, which is $174.70 a month, and it's in the second payer position. So if it's a good group plan, you like it all, have A only. And then once he retires, then you can pick up B at a later date during a special enrollment period. Now, the logistics of that could be a little bit of a hassle because his employer is going to have to fill that out on your behalf. So you know what I would do? Why don't you call in? There's a couple different ways this could be handled, and our agents would tell you what your options are. So, and let's answer your question about needing an HSA. Well, you can't be contributing to an HSA. HSA means that someone is working and they have an employer-provided plan that is high deductible, and then that employer has set it up so that you can contribute to an HSA, which is attached to a high deductible plan. So again, you can't do that anyways because you're on Social Security. And so being on Social Security, you have to have at least A. Don't have to have B if we have a group plan. So again, I think you got to call in. Okay, this could go a lot of different ways. Sorry to be confusing. Let's keep going. All righty. Are colonoscopies covered? How often? Yes. There's a variety of them. Now, the one that's that kind of full-blown one, if someone is in high risk, is covered every 10 years, just once every 10 years. That's that. I don't know, flex one. But there are a variety of other ways you can get colonoscopy type of work done. Some through blood, some through fecal. There's a different type of coverages for those. But the full-blown one, again, once every 10 years, unless you're high risk, they find a polyp or something, then they could be more frequent. Let me tell you the best way to find that out. Go online and look at the Medicare New Book. And they have a whole section on preventive screenings. And then we'll go through the different list of colonoscopy type of things that you can do and how often they are and when there's a small cost or no cost. Medicare New, it's a great resource. All right, my 70-year-old friend cannot get on a D-SNP because Medicaid won't cover 4 expensive drugs. So she's on MA and RX is the normal Medicaid. Sometimes won't pay for it. Oh, boy, can I get on D-SNP? So she's on, okay, I got it. Is this normal Medicaid sometimes won't pay for higher price meds? Okay, well, I don't know what they're asking. Can you figure out that? I just don't understand your question. If you're still watching, if you want to clarify that, Goldie, I don't know what you want me. I mean, what you're saying makes sense. I could see that there could be some meds not in formulary, but I think you're going to have to ask more. All right, Charlie, 69, still working full-time, good company plan, but they don't cover 83,000 procedures that I believe Medicare covers. Any suggestion? Okay, well, what I would do probably is drop the group plan if you want. Most people right now that are going on Medicare are getting A and B, $174.90. You get a plan G, you're going to probably spend $125, $140. So depending on what's costing you out of pocket, Charlie, on the group plan, you may be able to make financially kind of a lateral move. Now, if your group plans cost $100 a month, then I probably wouldn't do that. But if you're paying, maybe $250, $300 a month, and go ahead and go on Medicare. And now you do have to ask your company at this age if you can go on any time, or do you have to wait till the company's open enrollment season? Because sometimes they require that. But if they don't care, then go on Medicare and get all these different screenings. And I guarantee you're going to have a lower deductible, because if you take a G plan, the Medicare deductible is only $240 for the whole year. I'm sure your group plan has a higher deductible than that. So just move on Medicare. Just find out when that's possible. Okay, let's go. No. Okay. No, you can't, Liz. In the old days, yes. You would have been able to do that. But here's the way it works now. They have a rule called the deeming provision, or deem provision. And that just simply means that once you file for Social Security benefits, you're deeming to file for every possible benefit available. Your own retirement, survivor, spousal, and whatever is the greatest amount, you have to take that. Okay. And so I know you're probably hoping you could draw 50% of his, and then your account keeps growing. You had to be born before January 1st, 1954 to do that. Anyone born after January 1st, 1954 cannot do that. You have to live with the deeming provision. You got to take whatever is the maximum available. Okay. No. Flexible spending accounts, there are some tax advantages, but they don't accumulate. HSAs, tax advantage, and those monies accumulate. Flexible spending, you got to spend that or you lose it. Use it or lose it on an annual basis. So when I said Part A, if you take it, you cannot contribute to an HSA. That does not apply to FSA's flexible spending. You can be on A and still have your flexible spending account, no problem. Okay, Mark, what I would do if I were you, because she has TriCare, number one, she has to take A and B when she turns 65. TriCare only pays second to Medicare once she's eligible. I know it's first now, but I'm telling you, 65th birth month, it no longer pays first, it pays second. So she has to take A and B. In that situation, A and B with TriCare, as I said earlier, I would not get a supplemental plan. I just think it's over insurance. I love supplemental plans. But in your situation, to me, it'd be a waste of money. And so what she may want to consider is have A and B with TriCare, or she may get enrolled in A and B, but instead of using original Medicare, she can use a Medicare Advantage only plan. They're called MA onlys. She gets her drugs through TriCare. She gets her Medicare stuff through the Medicare Advantage plan. And then she gets all the perks, and she'll probably get a Part B reduction. Like I said earlier, about $100 a month, some of these plans will give her back on Part B. So you reduce the Part B, you get the perks offered by the Advantage plan. The only thing you have to do in that situation is make sure her doctors are going to be in that Medicare Advantage network. That's it. And the beautiful thing is, Mark, you're not bound to that plan forever. If you don't like it during open enrollment, get off of it and go back to A and B with TriCare. No problem. Most people can't do that, but you can, or she can. Okay, thinking of going part-time, currently on employer insurance plan. What happens to Medicare B? When do I have to take B if working part-time? Well, here's the way it works, Kathy. It doesn't matter whether you work part-time or full-time. What matters is your company going to continue to extend those benefits to you as a part-time employee? So if the insurance is not going to change and you're still employed, whether you're working 10 hours a week or 40 hours a week, doesn't matter. It won't matter. You don't have to take Medicare B if you can stay on that group plan. Okay, as long as you're employed. Because when we go in to put you in a Medicare at a later date, that form called the L564 doesn't ask whether you're full-time or part-time. It just says, were you employed and were you covered by a group plan? And if you answer yes to that, there's going to be no problems coming into Medicare at a later date. Okay. Okay, well, Medicare, supplemental presumed dental, be set up automatically, withdrawn from my Social Security account. Okay, so here's where it goes. If you're on Medicare, let's deal with that first. Medicare A and B, if you're on Social Security, the premiums for Medicare B have to come out of your Social Security check. If you're not, what they will do is they will bill you quarterly for those, quarterly. So $174.70 times 3. That can be paid online through your online bank account quarterly. It can be paid through your MyMedicare.gov account, or you can pay monthly through what's called Medicare Easy Pay. So people that are not on Social Security that would like to pay monthly, that's really the best way to pay for it. Set up an account with it's called Medicare Easy Pay. And then they'll draft out of your bank once a month the Part B premium. Otherwise, you're going to have to pay quarterly. So that would be that. Supplemental plans, you pay for those through a bank draft. Prescription drug plans can come out of Social Security, or they can be direct bill, or they can come out of a banking account. So prescription, we've got several payment modes to choose from. Supplemental's one, bank draft. Medicare, Social Security, or direct bill. Dental, again, is going to be a bank draft. There's no dental plans that are going to come out of Social Security checks. So you set up an ACH on those. Okay, for supplemental plan insurance, do the premiums go off of what you made the last few years? No. The only thing that goes off of your income is the Medicare Part B and the D plans. Okay, so supplemental plans are the same cost regardless of your income. It's just based usually upon your age and your gender and where you live determines the rates on supplemental plans, usually. Okay, so income doesn't matter. We about done?
I think this is a follow-up in the last one.
Okay, very good. Okay. Already did. So we have no more questions?
Yeah,
We're good? Okay, folks, listen, we're going to close this down. Hopefully you learned a lot. And by the way, in a couple of weeks, we'll do this again. I want to thank Jen for being our question screener. And please, if we can help you, see the number there on the screen, call that, and we'd be delighted. Keep in mind, we are brokers, independent brokers, so we usually have lots and lots of options. One size doesn't fit all, so we'll shop everything for you, no cost at all for our services. The insurance companies always pay the agent, not you, and we'd be delighted to help. Go to our website, MedicareSchool.com, if you want to learn more. Got lots of videos and instruction there for you, and we'd be delighted to serve as your Medicare broker if you reach out to us. Thanks so much.